a big thing that you are advertising is your qualification as being a mother. And I was wondering, what about being a stay-at-home mom, or did you work also?
For a long time. I'll tell you what, I do think that being a mom is one of my primary qualifications. I bring a lot to the table. I've worked in the health insurance industry. I run a successful small business. I've been a radio talk show host, debating and discussing current events with some of the best informed people in the nation and the world, 2 hours a day, 5 days a week. But it is my experience as a mom that I think is most pertinent right now. When we talk about all of these issues, the cost of fuel, the cost of groceries, the cost of health insurance. We never even got a chance to talk about health insurance tonight. That's a critical issue for families and individuals throughout New Hampshire today. I understand how the inaction of Congress hurts real people. I understand what people are facing when they get to the end of the week and they're literally choosing to put gas in the car or food on the table. When families have to, there are families in Coos County that I know of personally who are combining their households for the winter, 2 families moving in together so they only have to heat one house. It is inexcusable that Congress has ignored these issues for as long as they have. It is inexcusable that Mr. Hodes has looked the other way for 2 years. You don't get to be hired for a job, not do it for 21 months, and then get hired to do it again. It's just not how it works. It's not how it's going to work in this election.
Now, you brought up you worked for the health insurance industry before, and how it is a major issue nowadays, especially. It's ridiculously expensive. What's your take on a policy for change?
You just hit on it. You just hit on what is the heart of the problem. It's the cost of health insurance. That's what we need to focus on. We can make health insurance affordable and accessible for all families, individuals, retirees, veterans. We can do this. The solution, the approach is more competition, more choices. And there are a lot of things that Congress could easily have done in the last 2 years, simple things they could have done that would have been steps in the right direction. One piece of legislation would allow people to purchase their health insurance across state lines in a manner similar to how we purchase our auto insurance. The markets would open, competition floods in, premiums come down, ratepayers see an immediate savings. We could allow small businesses to pool their employee base so that they can purchase their health insurance in bulk. One of the ideas that I have that I've talked about a lot that I think is a good idea is something I've learned from my time in health insurance. Doctors used to charge health insurance companies in what they call DRGs, diagnosis-related groups. Any diagnosis in this group got billed under the same number. Why can't we break up health insurance the same way? There's some base that you can purchase that's very affordable, catastrophic illness and accident. But then you have a menu, groups of coverage that you purchase based on your need at any given point in any stage of your life. A 22-year-old fresh out of college in his first job, living the high life in the big city, he has very different health insurance needs from a 32-year-old couple with 3 children. A retiree doesn't need pediatric immunizations, doesn't need preventative health care for children, pediatric visits. So let's break it up so that we're paying for what we need and we have the flexibility to change it as we move through life. Those are just a couple ideas. The truth is every state in the nation is addressing this issue right now. There are hundreds of great ideas out there. We have to get away from the mindset that there's only one solution and bring all these voices to the table to work together.
Now, a big platform, especially for Barack Obama, is socialized healthcare. And working in that field, what's your opinion?
It can't work. It really can't work. I'll tell you, it will cost billions of dollars, and it will take the decision-making for critical health care out of the hands of patients and families and loved ones and put it in the hands of government. And all you have to do is look at the nations where they have tried to employ national health care. We are servicing their most critically ill patients in the United States because they cannot get the care that they need where they live. In Canada, people had to sue the country, had to sue the government to get the right to purchase supplemental private health insurance because they weren't able to get the care that they needed under their national system. It will cost billions of dollars and will take critical decision-making responsibility out of the hands of the patient and their family and put it in the hand of bureaucrats. It cannot work. It's wrong for America.